This course equips CNAs and healthcare workers to recognize early warning signs of critical medical emergencies affecting major body systems, respond appropriately, and communicate effectively to ensure timely intervention and patient safety. Medical emergencies demand fast, accurate assessment and action. CNAs, by virtue of their continuous patient interaction, are uniquely positioned to detect changes early. Understanding emergencies. First, it is important to differentiate urgent situations from non-urgent ones. While some changes may simply require routine reporting, others demand immediate attention and rapid intervention. Legal and ethical considerations. Next, CNAs must remember that their role is guided by both scope of practice and facility procedures. This means acting quickly, but never performing tasks outside of training, ensuring both patient safety and legal protection. CNA responsibilities. In practice, CNAs are expected to maintain vigilant observation of patients, watching closely for any changes in condition. When abnormal signs extend beyond normal care, the CNA must recognize them as potential emergencies. At that point, the correct response is to follow protocols, calling for help immediately, and providing only the basic support allowed by training until more advanced help arrives. In short, medical emergencies demand calm, quick, and correct action. By moving smoothly from recognition to reporting to basic support, CNAs serve as the first line of defense in patient safety. Transitional thinking, observe, recognize, act, is what makes the CNA's role in emergencies so vital. Stroke occurs when blood flow to the brain is interrupted, causing brain damage. Rapid recognition is crucial to reduce lasting effects. Types of stroke. First, it is important to understand that there are two main types of stroke. Ischemic stroke, which occurs when a blood clot or blockage interrupts blood flow to the brain. Hemorrhagic stroke, which happens when a blood vessel in the brain ruptures, causing bleeding. Although the causes differ, the outward signs may look very similar. Common signs, the FAST method. Next, CNAs should remember the acronym FAST, which highlights the most common and recognizable signs of stroke. Face drooping. One side of the face may appear weak, numb, or droop. Arm weakness. The person may be unable to raise one arm, or one arm may drift downward. Speech difficulty. Speech may sound slurred, strange, or hard to understand. Time. If any of these signs appear, it is critical to call emergency services immediately. Using FAST helps CNAs act quickly and decisively. Additional symptoms. In addition to FAST, stroke may also present with other sudden changes such as confusion or difficulty understanding, blurred or double vision, severe unexplained headache, loss of balance, dizziness, or poor coordination. Recognizing these warning signs is just as important because not all strokes look the same. CNA response. Once stroke is suspected, the CNA must act without delay. First, activate the facility's emergency response system. Then, keep the patient safe and comfortable, but do not give food or drink, since swallowing may be impaired. If trained, monitor vital signs and report them immediately. At the same time, offer reassurance to reduce fear and anxiety. Finally, document the exact time symptoms first appeared, since this information is critical for medical treatment. A myocardial infarction results from blocked blood flow to heart muscle, leading to tissue death. Common signs. First, it is important to be familiar with the most frequently reported symptoms. A patient may complain of chest pain or pressure, which can radiate to the jaw, neck, or arms. This is often accompanied by shortness of breath, cold sweats, nausea, or lightheadedness. Some patients may also report unusual fatigue or sudden weakness, which should not be ignored. Atypical signs, especially in women and the elderly. In addition to the classic symptoms, certain groups may present with less typical warning signs. For example, women and elderly patients may experience jaw pain, back pain, or discomfort that feels similar to indigestion. Because these signs can be overlooked, CNAs must stay alert and report them promptly. CNA response. Once warning signs are observed, the CNA must act immediately. The first step is to call emergency services without delay. Next, assist the patient into a comfortable position, often sitting upright, to reduce strain on the heart. Loosen any tight clothing to make breathing easier and continue to closely monitor the patient's breathing and pulse. Be prepared to initiate CPR if the patient becomes unresponsive and facility protocol allows. It is equally important to remember what not to do. Never give the patient food or fluids, as this could complicate emergency care. Instead, stay calm, provide reassurance, and avoid unnecessary movement. Finally, document and communicate the time the symptoms began, as this information is vital for medical staff. Respiratory distress occurs when patients cannot breathe adequately, reducing oxygen supply to the body. Signs of distress. To begin with, respiratory distress often shows through noticeable breathing changes. These may include rapid, shallow, or labored breathing. In addition, patients may use accessory muscles of the neck and chest to help them breathe. Furthermore, cyanosis, a bluish color of the lips, face, or extremities, is a serious indicator that oxygen levels are dangerously low. Other warning signs can include nasal flaring, wheezing, anxiety, restlessness, or confusion. Common causes. Next, it is important to understand what may trigger respiratory distress. For instance, asthma attacks and COPD exacerbations are frequent causes. Likewise, pneumonia may impair normal breathing, while choking can suddenly block the airway. Recognizing these underlying causes helps CNAs respond appropriately and promptly. CNA response. When signs of respiratory distress appear, CNAs must act quickly. First and foremost, notify the nurse or emergency team immediately. Then, assist the patient into a position that eases breathing, usually sitting upright. If trained and the patient has an oxygen order, administer oxygen as prescribed. At the same time, monitor vital signs closely and encourage the patient to take slow, deep breaths if they are conscious. Finally, ensure the airway is clear, and if trained, assist with suctioning when necessary. In short, recognizing respiratory distress means observing breathing difficulties, skin color changes, and behavioral signs. By combining quick action with clear communication, CNAs play a crucial role in preventing further decline and supporting life-saving treatment. In addition to breathing problems, CNAs must also recognize other critical emergencies such as shock, seizures, and sudden changes in mental status. These conditions can develop quickly and require immediate action. Shock. When the body is not getting enough blood flow, signs may include pale or clammy skin, a rapid pulse, low blood pressure, confusion, and overall weakness. Because shock can be life-threatening, it requires urgent medical attention. Seizures. A seizure may appear as sudden, uncontrolled body movements or a loss of consciousness. During this event, the CNA should focus on protecting the patient from injury by moving nearby objects out of the way. It is important not to restrain the patient's movements, as this can cause harm. Altered mental status. Sudden confusion, agitation, or decreased responsiveness can signal a serious problem such as an infection, medication reaction, or neurological issue. Recognizing these changes quickly can prevent further complications. CNA response. In each of these emergencies, the CNA's role is to stay with the patient and ensure safety while immediately reporting the situation to nursing staff. Careful documentation of what was observed is also essential for proper medical follow-up. Emergencies in healthcare settings demand quick thinking and confident action. Emergency activation. First and foremost, you must know how and when to activate the emergency system. This could mean calling a code within the facility or dialing outside emergency responders. Quick activation ensures that advanced help arrives without delay. Basic life support, BLS. If you are certified in BLS, you may be called upon to assist with CPR or help maintain an open airway until licensed staff take over. Even if you are not performing compressions, your role might include bringing the crash cart, positioning equipment, or ensuring space for the resuscitation team. Safe patient handling. In emergencies, it is tempting to move the patient quickly. However, Avoid unnecessary movement unless safety demands it, such as in a fire or if the patient is choking. Always prioritize protecting the airway and maintaining spinal alignment if trauma is suspected. Communication. Equally important is timely and accurate communication. Relay vital signs, observe changes, or patient statements to the nurse or emergency team immediately. During high-stress moments, being calm and precise prevents confusion and ensures the team acts effectively. Emotional support. Finally, never underestimate your role in providing emotional support. Offering reassurance to patients helps reduce fear, while comforting families fosters trust and calm in the middle of crisis. Your presence can make a frightening situation more manageable. CNAs must stay calm, activate the emergency system promptly, support the healthcare team, and ensure patient safety and comfort until advanced help arrives. In emergency situations, effective communication and accurate documentation are crucial. First, CNAs must focus on clear and concise reporting, using objective language that describes what was observed, such as specific signs, symptoms, and the timeline of events, rather than personal opinions or assumptions. To ensure smooth handoffs, tools like SBAR, situation, background, assessment, recommendation, help organize information quickly and effectively. At the same time, timely and accurate documentation supports continuity of care and provides legal protection. Finally, even under pressure, CNAs must maintain confidentiality, safeguarding the patient's privacy at all times. Preventing emergencies is just as important as responding to them. CNAs play a vital role in keeping patients safe by watching for early warning signs, teaching healthy habits, and working with the care team. Prevention starts with regular vital sign checks, allowing CNAs to spot early signs of distress. Through patient education, aides can encourage treatment adherence and healthy lifestyle choices that reduce risks. Safety is also key. Fall prevention strategies protect vulnerable patients from emergencies. Beyond that, CNAs must practice ongoing observation, noticing even subtle condition changes. Finally, collaborative care with nurses, therapists, and physicians ensures the best outcomes for patient health. By mastering recognition of distress signs and appropriate CNA responses, healthcare workers become critical links in the chain of survival and patient safety. Early detection and prompt action save lives and improve patient outcomes.